Thanks for joining our monthly healthcare provider briefing webinar, where we share relevant public health updates regarding COVID-19. My name is Dr. Cindy Shen. I'm a public health physician at York Region Public Health, and I'll be presenting the webinar with Dr. Azim Kasmani, who's a resident physician in public health and preventive medicine doing a rotation here. Also with us today is Dr. Richard Gold, who's an associate medical officer of health at York Region, supporting the immunization work, and he will be participating in the Q&A session following the presentation. As always, a very big thank you to our corporate communications partners, Kiosk Planning, and to our team who have put this together. So thank you, Anastasia, Deanna, Emily, Joan, Sari, Sumit, Tara, and Umar. Next slide, please. So a few things to note before we start. This meeting will be recorded. We'll go over the presentation first, and we'll have some time after the presentation for questions and answers. Throughout the meeting, you will be able to ask questions and share your thoughts using the chat box. Questions would be sorted to avoid duplication. Your name will not appear on the screen to attendees, although the presenters and moderators would have access to this information. If you have any questions about the recording of this webinar, please contact Liaison at the email address noted here. Next slide, please. To ask a question, you can click on the Q&A icon on the right side of the screen. You can then type your question in the compose box and select send. Questions will be screened by the moderator and posted to the presenters. We will try to get through as many questions as possible, and answers to any outstanding questions will be sent through Public Health Matters after the webinar. Next slide. So we'll be going over several topics today. We'll start with an epidemiological update, including some information on the Delta variant, then go through a few provincial updates looking at the reopening plan and also recent directive and guidance changes. And lastly, we'll address a number of vaccine-related updates. Next slide, please. So we'll be starting with some epidemiological updates. York Region continues to experience a decrease in case counts since the peak back in mid-April. As of June 6th, our 7-day case average was 52 cases, and our incidence rate was 30 cases per 100,000 population. In addition, the number of new hospitalizations also began to decrease recently. Next slide. The overall number of outbreaks appears to have followed a similar trend. While childcare outbreaks reached a peak in early May, since then, there has been a decline in the number of outbreaks in this setting. Similarly, we began seeing a decrease in the number of institutional outbreaks over the past few weeks. We continue to have a number of workplace outbreaks. However, the numbers before mid-May are likely underestimates as a result of operational changes. So the number of workplace outbreaks over the last few weeks are more likely to provide a more accurate picture of the situation. And with the increasing immunization efforts, including mobile workplace clinics, we anticipate improvement in cases and outbreaks for workplaces as well. Next slide. We continue to carefully monitor the situation with variants of concern. So as you likely know already, the World Health Organization has a new naming system for variants of concern and variants of interest. This system uses Greek alphabets as they're easy to pronounce and non-stigmatizing. So the B.1.1.7 variant is called the alpha variant, the B.1.3.1.5 is the beta, P1 is gamma, B.1.6.1.7.2 is delta, and B.1.6.1.7.1 is kappa. Looking at the variant situation in York Region, about 82% of all COVID-19 cases screened positive for at least one mutation of interest. Among those that screened positive for a mutation of interest, 85% or more are assumed to be the alpha variant, also known as the B.1.1.7. There were a number of samples that were sequenced as well, and most of these are again the alpha variant. In our region, a total of 11 B.1.6.1.7 variants were reported, and the province is working on enhanced surveillance through whole genome sequencing, which can hopefully tell us more about the variant situation, including for the B.1.6.1.7 lineage. Next slide. So here's more information on the Delta variant. On May 10th, the World Health Organization characterized B.1.6.1.7 as a variant of concern lineage, which contains 3 sublineages. B16172, or the Delta variant, was designated as a variant of concern, while the B1617 variant, also known as the Kappa variant, was designated as a variant of interest. And of course, the specific designation of sublineages may change as evidence on their various attributes continue to emerge. There are a number of mutations of concern for this lineage. You may have heard about the E484Q mutation, which lies at the same location as the E484K mutation shared by the beta and gamma variants. Another spike gene mutation, which is shared across the sublineages, is the L452R mutation, and also a number of other mutations were identified for this lineage. The B1617 lineage first appeared in October, and as of last week, it has been reported in more than 60 countries around the world and have become the predominant strain in some of those countries. In Canada, this lineage has been reported in most of the provinces. The Delta variant appears to be more transmissible. So for example, data from the UK indicates that this variant can be up to 50% more transmissible than the Alpha variant. The current evidence suggests that vaccines are effective against the Delta variant after 2 doses. So the Pfizer-BioNTech vaccine was estimated to be 88% effective against symptomatic disease from this variant 2 weeks after the second dose, and 2 doses of AstraZeneca vaccine was found to be 60% effective. It was noted that for both vaccines, a single dose had reduced vaccine effectiveness. However, as with other variants, higher levels of effectiveness are expected against hospitalization and death, and evaluation is ongoing in this regard. So given these characteristics of the Delta variant, it is anticipated that they have substantial growth advantage. Of course, the situation is being monitored very closely, including through representative and targeted surveillance by the provincial lab system. And especially given this newer variant, it would be important to continue following public health measures, and being vigilant is key. The other important action is, of course, to roll out the vaccines as quickly as possible, including for the second doses. And as you likely know already, this is being worked on, and the specific updates will be discussed during the vaccine update section. And as always, the evidence regarding the variants continue to evolve, which will further help guide our action. Next slide, please. So moving on to the provincial update. On May 20th, the provincial government announced a 3-step plan for a gradual reopening of the province. Each step of the plan is tied to a specific vaccine coverage and other key public health indicators. So moving through the steps, the province will remain at each step for at least 21 days to evaluate any impact on these indicators. Then, if the indicators trend in the right direction, the province will move on to the next step 2 weeks after the vaccination rate thresholds have been met. So the vaccination rate thresholds are provided here. Step 1 requires 60% of adults to be vaccinated with 1 dose. And based on this, the plan is to enter step 1 starting this Friday, which is June 11. Step 2 requires 70% to be vaccinated with 1 dose and 20% vaccinated with 2 doses. And step 3 requires 70 to 80% vaccinated with 1 dose and 25% vaccinated with 2 doses. Next slide. So what are some of the changes anticipated for step 1 of this plan? Currently, some outdoor recreational amenities are open with restrictions, and outdoor limits for social gatherings and organized public events is set at 5 people. And in the meantime, other public health measures under the provincial emergency brake are still in effect until step 1 begins. So when the province enters step 1 of reopening on Friday, more outdoor activities and smaller crowds will reopen, along with more limited indoor settings, all with restrictions in place. For instance, outdoor social gatherings and organized public events can have up to 10 people. Non-essential retail is permitted at 15% capacity. Outdoor sports, day camps, and campgrounds can open as well, along with outdoor dining with up to 4 people per table. And you can find more information on our website provided here. The other provincial update related to reopening is that, of course, elementary and secondary schools would not be resuming in-person learning before September. Next slide, please. So there have also been some directive and guidance changes from the province. Directive 2 for healthcare providers was rescinded back on May 19th, such that non-urgent and non-emergent surgeries and procedures may be gradually resumed by healthcare providers and healthcare entities. Directive 3, which was issued to long-term care homes and retirement homes, has been changed a number of times recently. The latest version was shared on June 4th, and some notable changes are that homes may gradually resume visitations as per the relevant sector-specific policy, although they're still strongly encouraged to schedule visits outdoors as much as possible. Homes may gradually resume non-essential absences as well. So in long-term care homes, fully vaccinated residents may have overnight absences, and in retirement homes, non-overnight absences are allowed for all residents, and overnight absences will be adjusted based on the reopening plan. There have been some changes to the case definition as well, and one thing to note is that an individual found positive on the rapid antigen test is no longer deemed a probable case directly based on the result alone. And of course, any antigen positive individuals should be tested immediately with PCR for diagnostic purposes. The use of rapid antigen test was also highlighted in the latest provincial testing guidance. So as you know, rapid antigen test is being used for screening purposes only. So anyone symptomatic who had an exposure or was part of an outbreak should not be tested using antigen test, but rather should be tested by PCR directly and be isolated for the appropriate amount of time. Next slide, please. So another recently released guidance document was the interim guidance for fully vaccinated people. Here, a fully vaccinated individual is defined as someone who had the last required dose of their COVID-19 vaccine at least 14 days ago. So at least 14 days since the second dose of a 2-dose vaccine series. All other individuals are not considered fully vaccinated, and this guidance would not be applicable to them. The other thing to note is that this guidance is not applicable to immunocompromised individuals for whom the standard public health case and contact measures will continue to apply. And it's important to know that any fully vaccinated symptomatic people or fully vaccinated COVID cases will still need to isolate as per the existing requirement, with symptomatic people requiring to be tested by PCR also. For fully vaccinated asymptomatic close contact of a case, the approach would differ by group. So any resident of congregate living settings or inpatient would need to isolate still and be tested even if they're fully vaccinated. And this is due to concerns for severe disease and higher risk of transmission in the setting. Otherwise, fully vaccinated asymptomatic close contacts do not need to isolate, and this includes healthcare workers. Now, there may be situations where the public health unit would advise otherwise. So it's really important to follow public health advice in any case if someone was deemed a close contact. It's also important to note that even if fully vaccinated close contacts do not require self-isolation, they will still need to be tested, as is the case if a fully vaccinated individual is part of an outbreak investigation. And of course, I've mentioned this already, but everyone should continue to follow general public health guidance and recommended infection prevention and control measures, even if they're fully vaccinated. Another new resource to note was released only a few days ago, is the COVID-19 guidance for individuals vaccinated outside of Ontario or Canada, which provides some information on the definition of fully vaccinated for those who have received vaccines outside the province or country, along with actions required for the various scenarios. So it's linked here for your information. Next slide, please. So now moving on to vaccine updates. Anyone aged 12 years or older who live, work, or go to school in York Region is eligible for the COVID-19 vaccine. And great progress has been made regarding vaccine coverage. Currently, our coverage of first dose among our 12+ population is over 73%, with over 9% fully vaccinated. We have achieved greater than 50% full vaccination coverage in our 80+ population. And the second dose coverage among other age groups over 60 years is also starting to pick up with recent eligibility expansion, which Dr. Kismani will be speaking to shortly. And we continue to work to get vaccines in arms, and we'll continue to monitor our immunization coverage. So now I'll hand it over to Dr. Kismani to discuss other vaccine-related updates.
Great, thank you, Dr. Shen. So I'll ask you to move to the next slide. So as Dr. Shen mentioned, the current vaccine eligibility for a first dose is anybody age 12 or older who live, work, or go to school in York Region. And as you'll be likely aware, there's an earlier second dose schedule rather than the initial 16-week interval that was recommended when vaccine supply was limited as vaccine supply increases. So at this point, we see that anyone who lives, works, or attends school in York Region that received their first dose on or before April 18th is eligible for a advanced second dose. Anyone who is age 70 years or older, so born in 1941 or earlier, and individuals with the highest risk health conditions, Indigenous individuals, and certain high-risk healthcare workers as defined by the province are all eligible as well. Now those links are there for you to be able to identify who is in which category. But just in terms of the individuals with the highest risk health conditions, those are people with the solid organ transplant, people who have received a stem cell transplant, people with cancers of the blood, bones, or lymph nodes who are undergoing active treatment, people with malignant solid tumors undergoing active treatment, those undergoing hemodialysis or peritoneal dialysis, and those with an autoimmune or inflammatory disease taking anti-CD20 medications. And then in terms of the second series eligibility, the Ministry of Health has also provided a nice guide on that, which you can click on afterwards on that link to access. So just to go through, I'll ask you to go to the next slide, sorry. For shortened dose intervals, the schedule as it follows, we'll see, we see the first three categories there we already mentioned. Moving ahead, these are all based on the anticipated availability of vaccine, and they may change as a result of changes in availability. We're hopeful that if there is any change, it's to make it second doses available sooner, but always we'll see it could go either way. But we have been so far moving faster than the original plan. And so it's also important to note, though, that individuals must always wait 3 weeks between first and second dose of Pfizer, and at least 4 weeks between first and second dose of Moderna, as per the product monograph. So you'll see the plan right now is on July 19th to open up to anyone who received their first dose before May 9th. As of August 2nd, it'll be anyone who received their first dose on or before May 30th. The week of August 9th to 16th, the hope is to reach adolescents who may be in school, so they can be ready 2 weeks before school starts. And then the week of August 9th, anyone else who has yet to receive their second dose will be eligible. So in order to book a second dose appointment, you can go to our website at york.ca/COVID-19 vaccine, or call in at the, oh sorry, I'll ask you to go to the next slide. Or call in at the phone number there, 877-464-9675. If there was a previously booked appointment, those will continue to be honored unless a new one is booked in its place. And on the next slide, we see that there's been quite a bit of talk about vaccine interchangeability. So NACI released their guidance on June 1st, and in it they advised that anyone who received an AstraZeneca or Covishield vaccine may receive either that vaccine for their second dose or an mRNA vaccine for their second dose, unless it's contraindicated. And Anybody who received an mRNA vaccine, so be that Pfizer or Moderna, should ideally receive the same mRNA vaccine for their second dose. So if you received Moderna for your first dose, you should ideally receive Moderna for your second, and Pfizer for your first and Pfizer for your second. If there are supply challenges, then they should be considered interchangeable, and it should be considered a complete vaccine series, even if there's a change between AstraZeneca and an mRNA, or between mRNA for availability purposes. In Ontario, the Ministry of Health has updated their guidance to align with that. Next slide, please. With regards to AstraZeneca, as you're likely aware, due to an observed increase in rare blood clots associated with the AstraZeneca vaccine, there was a pause on May 11th on additional first doses. Starting June 4th, so last Friday, second doses were made available to people. As we mentioned, this was in line with NACI's recommendation, so people could receive either a second dose with AstraZeneca or a second dose with either Pfizer or Moderna vaccine at least 12 weeks following in Ontario. There is ongoing research into the risk, but from what we know so far, it seems that the risk of developing blood clots associated with these vaccines after the second dose is much lower than it is after the first dose. And I'll ask you, just in terms of receiving the second dose of AstraZeneca in or an mRNA vaccine following initial AstraZeneca after 12 weeks, in York Region, it will be offered through the pharmacies primarily. So the pharmacies at this time for the second dose following AstraZeneca, whether it be a dose of AstraZeneca or a dose of mRNA. I'll ask you to go to the next slide. For children, currently Pfizer is the only vaccine authorized by the Government of Canada for those who are 12 years and older. I understand that Moderna has submitted an application to Health Canada, but it is still under review. And individuals must actually be 12 years or older on the date of their appointment. So for many of the other conditions, it's been 12 years or 65 that year, but for this, it has to be 12 years as of your appointment. The Pfizer vaccine has shown 100% efficacy in clinical trials for adolescents of that age, and we don't yet have real-world effectiveness data because those that group of individuals have just started receiving the vaccine in different areas around the world. And although it's true that COVID-19 is generally less severe in children, we're seeing, especially with the variants, that they can still get it, still transmit it, and still become sick. So vaccinating children helps to protect them as well as the people around them, and certainly will make in-person schooling safer in the fall or when school resumes. Next slide, please. The other thing that we've recently learned about is an early signal for potential myocarditis or pericarditis following COVID-19 mRNA vaccination. It tends to be most commonly, from what we've seen in international reports, after the second dose, most commonly, typically a few days after vaccination. Usually young adults or adolescents, and more often seems to be occurring in males than females. From what we've been able to identify in the literature and from reports across internationally, I should say, most cases appear to be generally mild and self-limited. Some require some mild treatment as well. There is not actually any clear association that has been established between acute myocarditis or pericarditis and mRNA vaccines. And information to date is based on ongoing surveillance. And the Public Health Agency of Canada, Health Canada, Public Health Ontario are monitoring this very, very closely. If you have individuals who present following immunization with an MR or with any vaccine, but especially with an mRNA vaccine, because that's all that's available now in this age group especially, you can consider myocarditis or acute pericarditis in your evaluation. I won't go through the how to evaluate because you all know how to do that. But what's important to keep in mind is to rule out other potential causes because it may go unrecognized from other potential underlying causes. Connecting with colleagues in cardiology, internal medicine, infectious disease may be appropriate in that workup. And if you do have a suspect or a diagnosed case of acute myocarditis or pericarditis, as with any other adverse event following immunization, they are required to be reported to York Region Public Health. And the links to the forms will be included. You can see them there on the slides, and they'll be included as well when you receive that, so you can click on that. To go to the next slide. And finally, not finally, sorry, I have a couple more slides, but quickly, update for NACI has also updated recommendations for immunosuppressed individuals, individuals with autoimmune conditions, or pregnant and breastfeeding individuals. So the change in recommendation here has now been made that NACI recommends that individuals in those categories have the same recommendation as a general adult population in that they receive a complete 2-dose vaccine series with an mRNA COVID-19 vaccine from either Pfizer or Moderna at this time. And so the other important thing to keep in mind is that individuals who are immunosuppressed, whether it be from disease or whether that's from treatment of disease, they should be informed that they may have a reduced immune response to the COVID-19 vaccine series. And as Dr. Shen mentioned earlier, immunosuppressed individuals do have different guidance on their case and contact management, even following both doses. I'll ask you to go to the next slide. And so in terms of rollout of the vaccine, the COVID-19 vaccines in primary care in York Region, Moderna is now available to be distributed to anybody who is 18 years or older. There are 70 primary care offices in the region who are administering Moderna vaccine. And anyone who has not yet filled out the primary care readiness survey but wishes to administer Moderna can send an email to heocliaison@york.ca. Next slide, and I think this is my last slide. So the other thing that many primary care providers and healthcare providers in our region have informed us is that they are unable to determine who of their patients actually has obtained a COVID-19 vaccine already. So there are a few ways to find out. One is by asking them. Patients are able to download their vaccine receipts on the ontario.ca vaccination page. As well, primary care providers who are authorized Ontario healthcare providers and have access to either Clinical Connect or Connecting Ontario Clinical Viewer can view their patient's COVID-19 vaccine information through the Digital Health Drug Repository. And the link to eHealth Ontario, where either you can sign up for that or access those services, is included on the slides. I'll turn it back over to Dr. Shen now.
Thank you, Dr. Kismani. So recognizing the need to further improve vaccine coverage among healthcare workers, York Region has compiled a list of strategies that healthcare facilities can consider to help improve staff vaccine uptake. This resource has been shared with a number of settings, including long-term care and other congregate care settings. So here's a list of main strategies that were identified in case they're of interest. The first is to engage vaccine champions, specifically having vaccine champions who are trusted by healthcare workers, such as facility leaders and seasoned staff, who can share their stories and their reasons for choosing to receive the vaccine. It's also important to co-design targeted strategies with them and with staff for effective communication. Another helpful strategy is to educate healthcare workers through one-on-one conversations and group discussions. So holding culturally and linguistically appropriate discussions with staff to address any questions, concerns, and to get input on how to increase vaccine confidence. Making vaccine uptake visible, so creating photo galleries and break rooms, recording and sharing testimonials, and encouraging people to share with colleagues, friends, and family that they received the vaccine. Communicating across multiple channels, so sharing consistent key messages in different formats, such as through posters, social media, and videos, and tailoring messages to the unique staff characteristics and needs within the facility. Partnering with others, such as faith or cultural leaders as channels of influence, and information sessions provided by the various credible sources can also be promoted. Working towards racial equity, so really acknowledging existing inequities and investing in diversity and inclusion work, acknowledging disparities in COVID-19 health outcomes by race and ethnicity, and identifying the peers and colleagues who have similarly lived and work experiences who can serve as champions. And lastly, supporting healthcare workers in getting the vaccine by promoting information about vaccine clinics and helping to provide opportunities for staff to attend vaccine clinics. Next slide, please. So those were some of the strategies that facilities can use to improve vaccine uptake among staff. And the strategy of having specific conversations about vaccines can be quite effective for building vaccine confidence. Healthcare professionals are an especially trusted source of information for people. So please discuss vaccines with your patients, family, friends, and colleagues, and really promote it in your community. Here are some tips for having vaccine-related conversations. So ensure conversations are respectful and start from a place of empathy and understanding. Show them that you're truly there to listen. Address any specific concerns and correct misinformation by sharing key facts from credible resources. Provide a strong recommendation for vaccination and tell stories in addition to sharing facts. So explaining to them why you and your family got vaccinated and tell stories of those who were ill with COVID. It's helpful to frame vaccination in terms of positive gains and really highlight the personal and community benefits of vaccination. By vaccinating, they're not just protecting themselves, but also those around them. And for people who work with more vulnerable populations, really highlight that their decision can help protect those with whom they work from severe illness and death. And of course, also the more people get vaccinated, the earlier that we may be able to return to a more normal life. Be honest about side effects when asked, and highlight the typical experience while sharing probability of rare events. Most of these side effects are localized and minor. On the other hand, having COVID-19 can result in severe disease. You can talk through a specific plan for where and when to get vaccinated, if appropriate, to help ensure that follow-up. And if they need more time to decide, refer them to credible sources, and you can offer to speak to them again. So one resource is York Region's webpage on vaccine information, which includes frequently asked questions on vaccines and quick fact sheets in multiple languages. And our COVID-19 information page for our health professionals also has a list of resources to help providers promote vaccine confidence, which you may want to take a look at. Next slide, please. So here are also a number of additional links that you may find helpful. The Center for Effective Practice has a COVID-19 resource center that provides practical evidence for primary care. The general healthcare providers page and general COVID-19 page on our York Region website can be of interest. And to report an AFI, you can access the AFI form provided here again. And there's the Ministry of Health webpage that contains all up-to-date guidance documents for the healthcare sector, and a webpage on vaccine-related sources that can be updated when new documents are released. Next slide, please. So that concludes the presentation portion of the webinar, and now we can take a look at the questions that you have. So there was a question related to the slides, I believe, and the recording. So yes, both will be made available after the webinar, and the slides should be circulated shortly after the webinar. There were a few questions related to vaccines. The first one is, if someone books sooner second dose, will the system delete the originally booked second dose? I'm not sure if Dr. Gold, if you have an answer for that.
Yes, it should do that. If you book the earlier appointment, it'll delete the former one, the later one.
Thank you, Dr. Gold. There was another question related to vaccine appointments. So is a booked appointment needed for a first vaccine, or can this be a walk-in? Dr. Gold?
At the moment, it would require booking, but we are looking at some drop-in clinics, outreach clinics, where walk-ins would be allowable. So there'll be more information about that shortly.
Thanks, Dr. Gold. There was another question from the audience. So has public health considered putting out a document that outlines all the advantages of being fully vaccinated to incentivize individuals? So thank you for that suggestion. I believe that there's work ongoing regarding the messaging related to building vaccine confidence. Your point is well taken, and we can certainly bring this back to the group as well for consideration of any other resources that may be helpful in that regard. I'm not sure if Dr. Gold, do you have anything else to add?
No, I think that covers it. Our communications team are looking at things like that to provide more information, to encourage people to get out, get the first vaccine if they haven't got it yet. We have a few like that, and certainly as soon as they're eligible to get their second dose.
Thank you. So I think those are the questions that we have so far. If you have a question, please submit them. There's another question here. So what is the efficacy of mixing AstraZeneca with any of the mRNA vaccines? Dr. Gold, I'm not sure.
Yeah, there's only been a couple studies looking at the mixing of AstraZeneca with the mRNA vaccines. I can't think off the top of my head whether it shows that there's much of an increase. There is some increase, perhaps in effectiveness with the mixing, but AstraZeneca as 2 doses is already quite high in terms of effectiveness, especially against severe disease. So adding a mRNA vaccine is not necessarily going to make a huge improvement. And we should have more information about that in the next, I guess, few weeks as more studies actually become available. There's really not a lot of evidence at the moment in terms of actually, peer-reviewed studies that look at the impact of mixing, but that'll be coming soon.
If I can just quickly add to that, there have been a couple of studies that look at antibody levels, but the results in terms of effectiveness and efficacy have not been published. But there is a study out of the UK, the COMCOV, as well as studies in Spain and Germany that are pending, as Dr. Gould mentioned.
Thank you both. There's another question. One patient had red and swollen arm for a week after Moderna, treated with steroid cream and antibiotics, asking about second dose safety. So maybe I'll try to take that one first, and if others have anything to add, please feel free. So I think it depends on clinically if it meets definition for reporting an AFI, and you can find that information on the health professionals webpage, and Public Health Ontario has a specific document related to when it's appropriate to report with specific temporal criteria. If it's treated with antibiotics and you think this is a cellulitis situation, you can feel free to submit that report, and it really helps us to keep track. And also, of course, it gets sent to the provincial level and national level as well as part of that post-marketing surveillance. In terms of the dosing safety, generally speaking, if it's a localized skin reaction, and in fact, if that's the case, then there's generally no contraindication, and it should be fine to receive the second dose. But like I said, if it meets definition for AP reporting, please feel free to do that. And if there's any clinical details that would be pertinent to mention, that's helpful too. And we can always provide you with a more fulsome recommendation based on that specific situation as well. So I hope that's helpful. Any other thoughts, please feel free to add. And there's another question about vaccines, lots of questions about vaccines. So what would you recommend in patients who had Pfizer vaccines 2 weeks apart?
Well, that's too short. That's something we can get back to you with specifically. There is a document from the ministry that talks about vaccine errors, don't call that, in terms for a variety of things. One of them would be around the dose being too close together. In the principles are such that if two doses are too close together, a shorter interval than what is recommended in the monograph, there's a decreased likelihood or chance that it will be effective. So whether or not you would then repeat it with a third dose, can check on that and provide that information and the feedback in our written responses, just so make sure it's as accurate as possible.
Great, thanks, Dr. Gold. So I'm not seeing any additional questions at this point. And I think we're almost at time, and thanks for the positive feedback as well from some of the folks who have submitted comments. So perhaps we'll wrap up now. Maybe we can proceed to the next page. Thank you. So you can subscribe to Public Health Matters by going to our health professionals page and clicking on e-newsletters for healthcare professionals. Please also do spread the word and encourage your colleagues to sign up. And as mentioned, we'll be sending out these slides after the webinar. Next slide. So we're wrapping up a bit early today, a few minutes. Thank you all for joining today and hope you have a good day and get to enjoy the nice weather.